So one concept which remains, which we must understand and which requires an explanation from me, is the natural history of disease. Natural history of disease has been asked in NEET in the form of a diagram. It can also be asked as a fill in the blank. They may leave a place somewhere and ask what will be filled here. Natural history of disease is a very simple concept, but unfortunately, when we read textbooks, it appears to be very complicated. The first thing, I always take natural history of disease at this level and not, the book has described it much earlier, but we should study it once we have finished with levels of prevention. So unless and until we have done levels of prevention, we will not be able to understand the natural history of disease. Natural history of disease is defined as what course a disease will take in different persons. A disease will take a course differently in different persons. In some it will kill, some it will be very mild infection, it may be subclinical infection. Some patient it will come and go, some patient it will come and leave a disability. So a disease can take multiple outcomes. So studying these outcomes, at what stage? When we do not apply any preventive or therapeutic measures. That is natural. We let the disease do its damage or good naturally. We don't interfere. So that is not possible. How can we not interfere in a disease? We are doctors. So we are unable to interfere in diseases when the disease erupted for the first time, like HIV came when we were students, postgraduate students, then HIV came. There was no prevention except for condom use. We were not very sure what to do. So that was the natural course of disease. Similarly with COVID. When the COVID came initially, we had hardly any treatment. We were not very sure of prevention. We were discussing whether it is a droplet or airborne or whether it is through fomites. So what does the disease do at that time, that is in nature, naturally, is called natural history of disease. So there are two conditions. Firstly, we have to provide natural conditions, means we have to study disease when there are no preventive and or therapeutic measures are being taken. And secondly, we have to follow the patients. I may follow 500 cases of COVID and see how many of them die, how many of them recover with chronic COVID, how many have developed other complications like thrombophlebitis or some mucormycosis, and how many of them recover completely. So these type of things, will give me that 1.5% die and about 20% recover, go into chronic COVID, and rest 80% recover. So these are the how many enter into ICUs. These were when we were passing through COVID. So we were studying and reading these things in the textbook, journals, and in newspaper also. So we divide for natural history of disease, we do longitudinal studies, or sometimes if we want to compare with normal people who are not suffering from disease, then the disease will be studied through cohort studies. Cohort means the patients of the disease COVID will be taken as cohort or the study group, and persons who have not suffered from COVID will be taken as controls. So that is the two ways of studying it. Basically, what we have to understand is that disease progression can be divided into three phases: 1, 2, and 3. One is before the disease enters into me. That we call it pre-pathogenesis stage. So the pathogenesis we know from our study of pathology, the disease process starts. But before that, there is a phase which is known as pre-pathogenesis phase. Now in pre-pathogenesis phase, what we community people or public health people want to advocate is that the agent, the environment and host, either one of them or more than one of them are not present. This means I am present, I am susceptible to tuberculosis, the overcrowding is present, the ventilation is poor, but the agent is not there, so I will not suffer. Or secondly, the agent is present, the environment is not, there is a good ventilation, no overcrowding, the host factors are, the person is has a high immunity, he is immunized for that disease, so the disease will not occur. So pre-pathogenic stage, this triangle is not completed. There is something which is missing. Either the one limb is not, the two limbs are not united, or three limbs are not touching each other. The second phase is pathogenesis phase. Pathogenesis phase will start when the organism enters into our body. So let us start. I take the, if I have to answer a question in examination, I will take the hepatitis B virus because of various. I will tell you later why I prefer hepatitis B virus an example. So here B virus enters into my body through injection or blood or sexual fluid, whatever route. And from here the stage starts with pathogenesis phase. So this is my pathogenesis phase. Correct? Now from here, there will be a long period of incubation period. In case of hepatitis B, it is long, 15 to 45 days. So in some other disease like non-communicable diseases, this we call it latent period. And after that, the sign symptoms will occur. So this period is nothing but incubation period. And this line is nothing but the line of clinical horizon, because in incubation period, sign symptoms are not there, because that is the definition of incubation period. That incubation period is a period from entry of organism to appearance of first sign symptoms. So here this stage is, we call it early pathogenesis. And once the sign symptoms appear, then we call it late pathogenesis stage. So first we must be very clear what is pre, what is early, what is pre and what is pathogenesis. And pathogenesis we can divide into early and late. Now here the disease organisms has not entered or have not entered. So this period, what preventive measures I can take? Because we have studied it, here I can do both primordial and primary prevention. Because both primordial is defined as prevention of risk factors and primary is defined as action taken before the occurrence of disease. The disease is starting here. So in this phase, the preventive action which can be taken are primordial and primary prevention. And in the primary prevention, both health promotion and specific protection. And this is the period of early pathogenesis stage. Here we can do secondary prevention, because secondary prevention is to detect the disease early. And actually we want to detect the disease early before the patient reports. So that is why one of the biggest tool or the best tool of secondary prevention is screening. or even active case detection so that we catch the patient early. Just he has got fever and we catch him that you may be suffering from malaria, give me your blood slide. And here, this is late, we will do tertiary prevention. So this is the basic of natural history of disease. Now I was telling you, if theory question comes, then I'll explain this thing, and I will take example of hepatitis B virus, because hepatitis B virus gives me a scope of making a very nice and a complex diagram which will impress the examiner. So here the pre-pathogenesis we have understood, here the pathogenesis incubation period, and here the course can be varied. It can continue to remain subclinical infection, so it doesn't cross the clinical horizon. It crosses and causes death, acute. It goes up, have symptoms and comes in and develops into chronic hepatitis, HIV, chronic viremia, carrier stage. Here it can cause chronic liver failure. Chronic liver failure can lead to cirrhosis. Cirrhosis can lead to carcinoma. So if you see, one disease, one infection is giving me a lot of scope to make a very nice diagram. I can make about 4 or 5 type of arrows going from death to death because of cancer, acute stage death, chronic stage death, chronic hepatitis, cirrhosis is there, complete recovery is there, subclinical infection is there, recovery with chronic carrier stage is there, and chronic carrier stage can again go back up into chronic liver failure. So these type of diseases, it gives me a very good nice scope, but don't worry about too much. You will think you will be able to do, you can take any other example also. It's not that hepatitis B is the only example. You can describe it with a non-communicable disease like diabetes, or you can hypertension, and you can discuss. This becomes the latent period, here signs, symptoms, and hypertension had got its own complications. So this here I will stop, natural history of disease. The uses of natural history of disease you will find in my notes. So I am not discussing, or you can find in the park what are the, why we use natural history of disease. So here I think in about 2 hours of lectures, about 120 minutes, we have done a very large and very important chapter. What is left in this chapter is a very, very important and very large topic, that is community diagnosis and community treatment, which I will be doing as a separate subject. Means I will take it as a next chapter even. It is so important, because what we do when we go to village is basically we are trying to do community diagnosis. So community diagnosis is very, very important from your examination point of view. So we will do it separately. Thank you.